Well, thank you for inviting us to this space. And for those who don't know me, my name is Thaddeus Pham, he, him. I'm with the Hawaii Department of Health, and I'm also co-director of our community coalition, Hep Free Hawai'i. People in Hawaii call me the Queen of Hepatitis, but you can also call me Your Highness. I'll respond to that. But I love that I got to enter during this discussion because this is truly what is the heart of our coalition. And you can already see our first slide is a quote from one of our syringe exchange participants when we were talking to our folks about what they saw as the opportunities and the challenges for Hep C treatment for people who use drugs. One of the I think most I'm getting a chicken skin, as we call it, or goosebumps right now, was someone saying to me, Thaddeus, I want to live a full life. And we really kind of use that to think about all the needs of our folks who are using drugs and other people who are affected by hepatitis. So I always open that up because I also, as you folks are already doing, want us to consider what is that full life and how can we reach that magical space where everyone can live their full lives. So this is, I do talk fast, I'm going to note, and voluminously, just like the lashes. So if at any point, you can always feel free to Q&A or raise hand or ask question, but I know we'll have space at the end as well. So this is Hep Free 2030, just a copy of our statewide strategy that we developed with community members. I'll go over that a little bit more. But first, I'll give you a little bit of context in terms of what's happening in Hawaii. First of all, I'll note we haven't had funded surveillance for over at least 15 years. So we've had to really do that Wild West public health thing where you just kind of get what you can to show the need, right? So from what we are able to pull together, we do know that when we talk with our policymakers and influencers, we know that hepatitis is one of the leading causes of liver cancer in Hawaii, and that Hawaii has one of the highest rates of liver cancer incidence and mortality compared to the continental US. So we're able to show some sort of burden that way. We also show that it burdens different communities disparately. And I always make a point here when I talk about this, this is not to shame or to denigrate these communities, but really for us to also consider these are the people we know and love. These are not only our clients, but these are our family members, our neighbors, our coworkers. We're all parts of these different communities. So we know that hepatitis A affects houseless folks, of course. We know that viral hepatitis affects sexual and gender minority communities in Hawaii disparately. We know hepatitis B really affects our immigrant, migrant, refugee communities, especially if they're born in Asia, Pacific, or Africa. I'm not going to belabor and read you data, but just to know these are just how we message it. And of course, we know hepatitis C affects everybody, but especially people who use drugs and people who are in jails or prisons, whether currently or formerly. So this is kind of some of the messaging we use to show that the need is there, even though we don't have current surveillance. We also always want to ensure that, we love data, but that data includes stories, right? So we always try to highlight the lived experience of our local folks living with viral hepatitis or affected by it. So I'm just going to name them. You can always look them up later on our website, but I'm going to mahalo right now Paige, Kenson, and Rensley, Jade, Peter and his mom Nga, Stacia, Eddie, Richard, Jewel, and most recently Richard's mom, Oki, who shared her story here. So we really believe that storytelling is an important data opportunity, and also this is an opportunity for us to build up people with lived experience so they become the new leaders, they become the voices that make the changes, and that they also get paid for their time, right? So we also try to create opportunities for them to get paid speaking gigs and things like that. But what is the gist of all this? Well, this is I think Annie had mentioned it's a complex issue, right? Especially when we're talking about substance use and related to syndemics and related to hepatitis. So we distill it to this now. This is really helpful for us. So we're like saying all the work we're doing is really trying to save lives. That's the crux of what we do for Hep Free Hawaii. And we back it up with some more recent data. So we say, look here on the left, we know that hepatitis B related deaths are 3 times higher in terms of rates compared to the continental US. And if you look at the right, it's really affecting our Asian Pacific Islander residents, including Native Hawaiian people. Then we also looked at more recent data from the CDC, and we found that, you know what, if you have hepatitis C in Hawaii, you will likely die 20 years earlier than the rest of the state. and how unconscionable that is. So our work is to give people 2 decades of life back, right? And when we talk with our legislators, we say this: can you have the opportunity to give 20 years of life back to someone? Do you want to take that step and help make that happen, right? And that includes many things, as Annie had alluded to, including harm reduction services, safer smoking. All of that is related to our work. And I'll just note the disparities here again. So with this idea of saving lives, right, this is what we're doing. How do we do it? And I think this is really important for us in Hawaii. We're very relational, as I'm sure you folks are in Oregon, but really it's through our coalition work. So luckily, Hep Free Hawaii has been around since 2011, and Heather Lusk, whom some of you know, and I joke that our elimination work actually started 12 years ago, when we first had our first meeting in Chinatown with 8 people in the back of a restaurant, right? So that time investment, that relational investment is really important for us. And this is just some highlights of what we've done over the past 12 years. I'm going to read each one to you now. Just kidding, I'm not going to do that to you. But visually, you can kind of see some of the stuff that's happened. But maybe to help you folks, I think more relevantly now is just how do we go through our strategy development process. And so what we did, we started the process in 2019. We gathered, much as you're doing now, about 45, a bunch of different constituents in different areas that are related to hepatitis. So syringe service, correctional, insurance payers, politicians, people with lived experience, health departments, and brought them all together to kind of start to convene and ideate what our state's elimination strategy would look like, right? We looked at a lot of other folks and we're like, that is cool, right? We like visual, we like public facing. That's not so cool, right? We don't want 1,000 pages that no one's ever gonna read, right? So we're kind of picking and learning from other states. And then what we did over the next year, which as you might recall is when COVID started, the pandemic, is we're still able to engage people through Zoom meetings. We had over 160 people engaged, over 25 formal meetings, not including informal meetings. For example, people texting me sitting in the back of the syringe exchange to see if any participants had any thoughts or ideas they wanted to share. In language engagement, so lots of what we call low threshold engagement, right? We love low threshold services, but let's make engagement low threshold too. Holding meetings outside of work time for people who don't get paid to do the work. That was really important to us. So a year later, right, the community came up with our local strategy, right? So the strategy really focuses on 5 priority areas underneath which are strategic directions. We didn't call it goals because we don't have surveillance, remember? But at least we know the directions we wanted to go, right? And then under each of those are micro elimination opportunities, because we figured that, you know what, the community knows best. And sometimes the community is a small community. So we use microelimination as opportunities for communities to identify projects, which I'll share some of those with you, and to move forward, right? Collectively, all contributing to larger elimination. So before I share some of those with you, I just want to note that at the beginning of every meeting, and I see Aaron is joining us, he's our hepatitis care coordinator, we always reiterate our values so that we are all thinking in the same direction, right? So every single Hep Free Hawaii meeting, we always say, as you know, we are going to ground our work in these 4 values, and that's harm reduction, right? Reducing harm, really centering communities. Social justice, so acknowledging that our work is not just medical or clinical, but really addressing larger social justice issues, acknowledging the intersectionality of the work so that people are whole people, right? They want to live full lives. So we really need to address all those things. And I think Annie mentioned it too. How do we address basic needs, right? Before we can address hepatitis. And finally, aloha, right? So acknowledging not only what that word means in terms of the Hawaiian culture, but also acknowledging the place and the people who came with the land that we're living in, right? And acknowledging the native Hawaiian kingdom. So we ground that every time. So no one is surprised when we start talking about housing as a hepatitis issue, when we start kind of pushing back against insurance payers, right? This is all part of the values of how we do our work. This is, again, values and practice. I'm just going to quickly read the quote from one of our steering committee members, but our fight against hepatitis is also a fight against stigma, discrimination, and inequity. This is our mission and vision. I'm going to read it to you verbatim. I'm not going to do that to you, but just so you know, it's here. All right, so what does this look like, right? So like I mentioned, our community over those many, many meetings came up with these 5 priority areas, and I'll go over each of them, but this is what we call our wheel of priorities. The beautiful thing I'm going to have you know is you'll see awareness and education at the top right, access to clinical service, advocacy at all levels, equity in everything we do, and data for decision making. You can see here that access to clinical services, the medical stuff, the testing, the vaccination, the linkage to care, the treatment is only 20% of our strategy, right? So really, again, acknowledging that great to work on the clinical issues, but really the other issues are really important. All right, so what does awareness education look like? I'm going to give you one of our highlights, and I'll give you some examples of each one, and then I'll close it out. But for awareness and education, I want to mahalo Anika. One of the things we're doing right now is a hepatitis C echo. We've been able to engage 55 to 60 local healthcare team providers, including pharmacists, hepatologists, primary care providers, nurse practitioners, PAs, everyone at every level, to really enhance their knowledge, but also to build the network of care, right? So that they know each other now and they can just call each other. So that's ongoing. It's been really successful. Others just highlighted microelimination projects under awareness and education are scaling up our social media. Follow us at Hep Free Hawai'i, especially if you are on TikTok. We're currently reviewing our website, and we're really trying to always check to see how can we make it easier to engage with, how can we use more plain language, right? How do we kind of just, again, low threshold engagement? And because we work in Hawaii and we work with a lot of Native Hawaiian and Asian Pacific Islander communities, language access is a major concern for us. And so we're always trying to create more accessible materials and also more accessible, I would say, opportunities, right? Not everyone is even literate in their own language. So how do we just not create a translated brochure, but create actually spaces where people can talk about it in their own language? Access to clinical services, so the medical stuff, we're currently working with our 2 commercial labs to hopefully remove solo Hep C antibody testing so that they could really promote Hep C reflex testing. There's some challenges around that for many reasons that they've shared with us, but we're continuing to push that, especially since the CDC recommends this as best practice. Here's some other clinical efforts that we're working on. One is integration and promotion of pharmacy-initiated Hep B vaccines at our local pharmacies. We'll also use some of that opioid money to create a small program for care coordination, whereby they're placed in syringe exchanges, methadone treatment centers, aid service organizations, and FQHCs to not only provide care coordination for Hep C, but also ensure that they get access to MOUD and vice versa. If someone is getting MOUD, that we want to ensure that they get screened and linked to care if needed for hepatitis C. And we're it's a multi-year process, but we're still engaging with our correctional system to increase the access to 340B medication and also to scale up their ability to treat and test. Something I'll note that is that even though we have an MOA with them to get 340B pricing, they haven't been able to get it yet for the past 3 years. And yet, because I think we're so engaged with them in this, they're already started treating more, testing more, and even figuring out their own ways of getting more medication. So I think the relationship building, again, is really important. Policy at all levels, this is where Heather Lusk comes in. So those of you who know her, you know she's really good at this. So one of the things we're trying to do is, of course, remove prior auths. They currently require, they've kind of hedged the bet, I don't know what to say, but really they create an attestation form instead, so providers can now attest that they will abide by ASLD guidance and that they've taken some sort of Hep C education, and that will allow them to waive the prior auths. But as Aaron knows, it's not just at the insurance payers, but it's also at the pharmacy benefit managers and the contract pharmacies where we're seeing a lot of the barriers as well. So we're continuing to work on that. We did have a legislative briefing earlier this month. We were able to push forth a local resolution to basically force our health committee to listen to us so we could share what's happening and also to share recommendations legislatively. And that really, again, built more relationships and highlighted Hep elimination as an important priority. We also are integrating into multiple plans, including our State Health Improvement Plan, which uses Healthy People 2030. And so we're integrating hepatitis into there, which also means we can get funding from them. And then, of course, we're trying to see how we can get those opioid settlement monies. Okay, in terms of equity, I'm going to mahalo Richard, one of our storytellers who leads this. This is an example of language access. Our Kenson and Rensley do in-language, culturally congruent engagement, right? Again, not everyone in a community wants to even read about hepatitis in their own language. So they identify the spaces where folks feel most comfortable, and they enter those spaces as a community member and share their own lived experience and share resources for them. And that's been really powerful. As more people trust them, they refer other people to get education and engagement. Other equity projects, of course, are storytelling. You already saw that. We always want to center our work on the people with lived experience as our ultimate experts. And with that in mind, we also are trying to start a drug user union, or what some folks call a community advisory board. I mean, the language is really just political sometimes, right? As you know, but whatever we call it, it really is hopefully going to be where the voices of people who use drugs are the experts, right? And not just to ask them about hepatitis or extract information, but really have them identify their own priorities and be their own kind of entity that we can come to when we have particular questions. And then finally, Richard is part of our queer community, and so he's going to work with our transgender and gender diverse and Mahuahine Mahukane communities to update materials, whether that's storytelling or actual posters or something, so to ensure that those communities' needs are met. Finally, don't get mad, get data, as someone once told me. Or nowadays, get mad and get data, right? Not mutually exclusive. So how do we use data? This is the quote I mentioned before. This is a recent report that we put out through the health department. I think it was really powerful for us to put out a qualitative report from the health department saying the voices of people who use drugs matters, and it should inform public health programming. And that was really the intention here. Not everyone wants to read a report, so we always create a one-pager. So you can see here some of the highlighted quotes and kind of the main themes that came out of this qualitative report here. But you can see here, number one, they said, use syringe exchange, fund syringe exchange, expand syringe exchange, right? We trust it, we know it, we go there, so make everything there so we don't have to look somewhere else. Provide information, reduce stigma, and also we don't want to read too much. Make it short and easy. Stop giving us pamphlets, right? Have a literally 2-sentence thing. Some examples are, listen, Hep C is curable. These are specific messages that folks share. So we're going to work on that as well. Other data things where we have funding from the CDC, and we're trying to hire someone right now. We're working through that process. You can imagine the bureaucracy that we have to deal with. It's been taking 2.5 years, but we almost hired someone to actually do surveillance. We're working with our FQHCs and their EMR data to create mini care cascades. So even though we don't have surveillance, we can use, at least we can know what's happening in a small community. And we do use publicly available data from CDC Wonder to create hepatitis B and soon our hepatitis C mortality reports. So another way of showing burden on our local communities. This is the link to all of our projects. I'm going to admit we haven't updated it in a minute because we have so many projects happening. I literally just presented you, I think 5 times 4 is 20 different projects that we're currently working on. But you can check there and hopefully we'll update it soon. A final thing I'll just note is we also want to uplift our local partners. So that's why we always recommend and support publication or conferences so that they can share their wisdom in other spaces, uplift our storytellers and leaders, and really just have more evidence base locally so we can cite something and show it to legislators and be like, the data shows that, right? So this is just another strategy that we use. Finally, wow, perfect timing. I'm exactly on the time for the agenda, I think. Our call to action. So this is just what we ask for locally, but you're always welcome to join our coalition, either as a partner, as an individual, join one of those 5 priority areas. Anika would have me always ask you folks to follow us on social media at Hep Free Hawai'i on TikTok, YouTube, Facebook, X/Twitter, and Instagram, and LinkedIn. Use your voice. So Aaron is here. He's actually working with us currently. One of his recent clients who's treated for Hep C wants to share his story. So we're going to pay them for their time to work with our local story filmmaker to create and share his story. And then, of course, we're always looking for feedback. So every suggestion that someone gives us is literally documented. And even if we can't become a project, we have it there so that we can kind of keep it in mind for future, or we can go back to it and amplify it later. As I noted, who wants to read a 20-page report sometimes, right? So if you don't have time, this is just a one-pager of that strategy that I mentioned, if that's helpful for folks. So we wanted to note that. And finally, this is just some of the contact information for our coalition. But I want to thank you all folks for listening, as I always talk so fast, but it's with excitement and aloha. And so thank you for the time. And I guess I'll turn it back to Anne and the leaders if there's any questions or comments. Thank you.
Thaddeus, thank you. And as usual, you've blown it out of the water. So many wonderful things, not the least of which is that this is truly a community-driven event. This is truly a community-driven initiative. It's been going on quite a long time. You use an incredible amount of social media to get the word out, to get the messages out. That is wonderful work. I have a question for you, and then I'm going to open it up to everybody else. There aren't any in chat yet. My question for you is, you, as a state employee, public health department employee, what is your strategy for all the wonderful advocacy you do?
Okay, so that is a great question. And I feel like folks might know the answer already, but it is a very inside-outside game. And Aaron can speak to this as well. So there's things that we can't do as health department employees. We can educate, but we can't advocate in Hawaii. Depending on the state, some folks can't even meet with their legislators. But I am here in my role at the health department to provide education, as you've seen, right? And to really also provide a lot of technical and logistical support, so community members don't have to always take notes or convene meetings. That being that kind of logistical backbone, I think, is the other support that we can provide. And so what we do is we defer to our community partners who are part of the coalition to make those specific advocacy asks and to make those specific call outs. And they can always, I'm going to say, consult with us if there's any support needed in terms of legislative or policy asks. So I believe that hopefully that answers the questions and folks know what I'm talking about.
It absolutely did. Education TA can go in a long, long way. Thank you so much. And that's why we're so grateful here at the Oregon Health Authority to be in partnership with the Oregon Viral Hepatitis Collective. Yes, and we're shamelessly plugging the Oregon Viral Hepatitis Collective for everybody who's on this meeting today to join us and join our voices and come together so that we can start a Hep Free Oregon. I mean, you are so inspiring, Thaddeus, and I know it has taken a cast of thousands to do this work. It always does.
And speaking of cast of thousands, I do want to introduce, I alluded to him, but Aaron Ruddick is here. He's our hepatitis care coordinator. If that's possible, Aaron, would you mind just sharing anything else you wanted to add that's helpful for folks to know?
Hello, everyone. Aaron Ruddick, he/him, hepatitis care coordinator at Hawaii Health and Harm Reduction Center in Honolulu, Hawaii. I don't have too much to share because you always do such a great job, but yes, it's very important to make sure that you pull together as a community. Always get the individuals involved that you're looking to serve in on the conversation is super important. They have great ideas, and if they will let you know what they need. And if you can jump in there and do that, you will be able to make a positive impact on that community, get the trust, get more people involved with you. So it's a really great thing. Yeah, other than that, I mean, open to any questions that y'all have, but yeah, and thanks for inviting us too. It's really nice to be here.
Nice having you. Thank you so much.
Hey, Aaron and Thaddeus, it's Lauren. So glad to see you guys. And, you know, Aaron, I want to ask you a question. I interviewed you, I think, on your first week at Hep Free Hawai'i in one of my projects of doing on the road to elimination, and you were brand new. I want to know what is your number one thing that you've learned in the last couple of years about hepatitis that really just you think everybody should know about in doing the outreach and doing the excellent work you guys do? What give me your number one.
I got two actually. So one of them is the systemic barriers having to do with our insurance and pharmacies and things along those lines. Lack of support in budgeting from our legislature with things that I really got my eyes open to and have been rallying against since I've been in this position. I'm like, no, this doesn't need to be this way. Let's start working on this. Let's start engaging people in conversations, try to change these things. Because what we want to do is we want to test, diagnose, treat, cure, and link people to other services in a timely manner. That's all we want to do. And it's totally doable, except that there's these barriers there. And so you learn what these barriers are and you take them on and you challenge them and you try to get rid of them, right? That's exactly what we're doing. So that's one thing on that side. The other thing, I come from an outreach background. So being out in the community, being out in the streets and talking story with people is nothing new to me. But it's really cool to see, like, when you engage people into hepatitis C treatment or conversations of hepatitis, and especially when they get cured, people really want to engage into more services. They start to trust you. They've got to win. Curing something is not something we do a lot of. So curing something is actually a really cool thing to do. And it's tangible. It's something that they can see. And once they knock it out, they feel better. They want to engage into more services. And we're happy to go wherever they want to go on that journey with them, So it's pretty cool to see what comes from that, and to be able to do the outreach, to be able to provide these opportunities for people to get cured, and then to see what happens after that is a really fun thing to do.
I'm going to note also that Aaron does love to push with us. I think now, Aaron, you came from the outreach, and now Aaron is helping us with policy, and he is one of our most passionate policy pushers because there's so many policy issues that he sees that directly impacts your work, Aaron, right, and your clients' lives. So
yeah,
that translation to policy, I think, is beautiful.
Yeah, I'm like, man, let's go do a sit-in or something like that. Like, I'll just go sit on someone's desk until they start listening to us, Like, the last thing I want to do, like, don't start jamming our people up because you're gonna piss me off, and we're obviously gonna do something about it. But I come from like, and then I got to be like, okay, slow it down a little bit. And it's nice to always have Thaddeus and Heather to help kind of fine tune that energy into something that they're gonna hear and hopefully put action into.
And for those of you on the call that don't know, the Hawaii senators and Congress people have been the leaders on the national level on hepatitis. And so, a lot of that is because of Thaddeus and Heather and Aaron and the work that they do in Hawaii with their partners. And so it shows in your leadership at the federal level that they get it and they hear you. And you're doing a great job, and it's helping all of us. So thank you. Other questions for these great folks?
I'm just looking at the chat, and thanks everyone for the kind comments, and also for I know a lot of people noticed the visual beauty of our content, and that was really intentional. So that, again, low threshold engagement, right? People want to look at it. It's not something kind of, I don't know, draining in a way. So we try to do less text, more visual, and just really try to always think about not only what we want to present, but also what people want to see, right? That kind of balance. So thanks everyone for noticing that. We appreciate that.
We really appreciate you guys coming here and telling us what our friends in Hawaii are doing and serving as a, I'm going to say, benchmark, a gold standard of where we'd like to go. I think you can see by the number of participants here today that we have some good, strong community voice, and corralling folks and working together is where we're going to be heading next to really roll out our new viral hepatitis elimination plan. and microelimination that are culturally specific, equitable to different community members, groups in our community who have high morbidity and mortality is going to be very, very important to that. So thank you for, again, for being that really amazing gold standard with Hep Free Hawaii, the HHHRC, and the Hawaii Department of Health.
Thank you. And always reach out
do
to us
have-
if you folks need anything.
You do have the prettiest plan of all the states.
Hey,
Yeah.
hey.